You can give him the other set of cans. We're Dr. Joe Wiedermann is in here, and we're just hanging. We're just hanging, listening to a little Barry White here, because after all, it's all about the love, you know. It's all about the love. Dr. Joseph Wiedermann, he's the interventional cardiologist, head of cardiology at the Guam Regional Medical City, and he's here for your healthcare partner. We thought we'd play some, mood music for you by Barry White. After all, it's Valentine's week. And, love is in the air.
He sings about the heart.
Yeah, and so that was my first question. Can you translate for us what that means? What is the symbol of the heart and love? Did you ever study that in med school?
Not so much in med school, but, for hundreds of years, there was the concept that the heart might be the seat of the soul. There were a lot of things that were based on essentially Greek medicine, where the heart was given a spiritual value that was more a cultural tradition than in any way scientific at all. So I think we get it mostly from that.
Mm-hmm. But how does that translate? Well, obviously into the emotion. If it's the soul of the body, and then the significance of breaking the heart or an arrow through the heart shows that there is some pain caused by someone you love.
Yes, the seat of suffering, as it is the seat of emotion.
Ah, okay. Wow. I'm impressed. I feel like you should go on, but I think that pretty much sews it up. And so is it in your experience as a doctor and having patients that when somebody has a heart ailment or some sort of has heart disease, do you ever talk to other doctors about that one organ being harder to lose or be diseased or succumb to disease than any other because of this sort of myth that we have about the heart?
No. I mean, at this point, I would say that the problem with organs like the heart is that they're single organs, right? So if you lose one kidney, that's not really such a big problem. If you lose one lung, that's also not such a big problem. But if your heart's only got one, you got a problem there.
Yeah.
So it's more in the nature of it being unique and necessary than anything else.
Yeah. So it is, as I understand it, February is Heart Month. Okay. And what does that mean to you?
Well, from my perspective, that just means we want to use the month of February to focus on potential heart ailments and how to prevent them, and also to focus on things which relate to heart disease that the general public may not be aware of, and use it as a month both to explain the progress that's been made in heart disease and also to make people aware of symptoms and signs that may make them want to seek attention.
Well, and I've come to find that the more that you know about some of these symptoms, and whenever you feel like a certain slight of something, that it always feels like that's what it is. How does a person really know that what they think that they're feeling is or isn't a problem?
Well, in honesty, the way to find out is to actually go see a doctor and figure it out, because you're not going to know. Some things are really fairly classical and should tell you this is really a problem. If you're climbing a flight of stairs and you're getting, squeezing chest pain, or climbing up a hill and getting squeezing chest pain that goes away when you stop, that's your heart, okay? So you should go see someone right away. It's more complicated when someone is just feeling, short of breath when they exert themselves, because it's hard to know whether that's lung disease or just being out of shape or what. But the main thing is to focus on if things are different than they were a few months ago, that's something to look into. If you have symptoms that weren't there a few months ago that appear to be new, at least go see your primary care physician and have them evaluate you, do a baseline EKG, and talk to you and see what's going on. And certainly if there's a reason to have heart disease, which means if you know that you're diabetic, if you know that you're overweight, if you have a family history, then you should be more keyed into the possibility that you might also develop heart disease. And especially in women, we often see more atypical symptoms. So, again, the majority of people, including women, tend to have chest pain exertionally when they have blockages in their arteries. But women will sometimes get atypical symptoms where they just feel like they have a really bad stomach ache, or they're very nauseous, and that seems to go on for a long time. And that sort of prolonged nausea in a woman can actually be a sign of a heart attack. So women need to be a little bit more careful about atypical symptoms and avoid what women tend to do much more than men, which is just deny it and say, oh, I'm okay. I've got to cook dinner for 12 people tonight.
And I think that's what the issue is, right? A lot of women tend to live with the pain, like nausea. For example, they just put up a wall and it's still there, but they will pop antacids until the cows come home, and that, is dangerous. Talk to me about your Cath Lab.
Well, so just to give you a description of what a Cath Lab is. So a Cath Lab is basically an imaging suite. It uses a very sophisticated imaging X-ray tube that gives very, very high detail images of vascular structures, basically. And we do the procedure by putting a small tube in someone's leg, not like an IV. And through that tube, we advance catheters, which are hollow plastic tubes, up into the heart. We inject a clear dye into the arteries that supply blood to the heart, and we look for any blockages in those arteries. And if there are blockages, we then go ahead, again, under X-ray guidance with just a 2-millimeter puncture in the femoral artery in the groin, so no surgery or anything. We go ahead and then pass a wire across the blockage, open up the blockage with the balloon, and then position a stent, which is a piece of metal tubing, into the artery to fix the problem. We also do diagnostic testing to look at people who have heart valve disease to see if the valve is leaking or narrow. So we measure pressures inside the heart chambers to see if there are not blockages, but other kinds of problems that involve valvular heart disease or a weakened heart muscle, which can occur from a number of different conditions.
Is that the sort of the normal procedure? That is, normal part of the process. I come to you and I have a concern. You take me to the Cath Lab. We do the test. Is that the process of it?
No, there are steps in between. We wouldn't take you to have an invasive procedure, which has a certain amount of risk. It's a small risk, but still it's a risk, unless we are really convinced that the problem is cardiac. So generally, if you come to me with exertional chest pain, if you have an abnormal EKG and your symptoms are occurring at greater and greater rapidity, in other words, you used to be able to walk 2 blocks, now you can barely climb 3 steps, I might take you straight to the Cath Lab. But in most cases, we'll do a stress test first, because the stress test non-invasively will show us whether there are indeed blockages, and then that would justify doing an invasive procedure. Similarly, for valvular heart disease or for a weakened heart muscle called cardiomyopathy, we would do an echocardiogram first to see if the valvular disease is really significant before we did an invasive procedure.
Okay.
So catheterization is always, let's call it the third step. The first step is a doctor sitting down with you and getting a good history and physical. The second step would be non-invasive testing. And if that is concerning, then we would go to invasive testing.
Now, do you know, like, for example, the stress test, you would put somebody on a treadmill, right? Or something like that,
Correct.
right? It just to exercise to get them up to a certain heart rate?
Yeah, we get them up to a certain, well, there are 2 ways of doing it. People who can exercise, we would exercise them to a certain heart rate and then do what's called a nuclear stress test, where we get images of blood flow to the heart using a nuclear imaging camera, again, non-invasively. But we also have a lot of people, whether because of being out of shape or because of orthopedic problems, who can't walk on a treadmill, and there are pharmacological ways of mimicking exercise. So there are drug infusions that we give people while they're lying down,
Right.
and then we take the same pictures to see if something's wrong.
Wow. How many patients do you see on Guam a year average?
Oh God, a year. I mean,
Well,
let's say I'm seeing 15 or 20 patients a week.
Wow.
So I don't know, 1,000 patients a year.
Wow.
Yeah.
And so clearly there are numbers to support that we have a serious heart disease problem on Guam.
Oh yeah. I mean, one of the problems is, again, why do you get heart disease? You get heart disease because of family history, because of hypertension, because of diabetes, because of smoking, all things which are unfortunately pretty prevalent on Guam.
Yeah.
So it's not like you've been chosen for heart disease, it's that there are other things on Guam that cause people to have heart disease.
And so are you saying that, do you say that then the majority of the patients that you see can reverse a situation if they change their lifestyle, as opposed to somebody who has it in their family?
Well, even if you have it in your family, you can do a great deal to prevent it developing by controlling your risk factors. So just to give you a sense of what it is that when I fix a blockage, I fix a blockage which is severe enough to impede flow, which means greater than 70%. Okay, so we'll fix those blockages. But the process of coronary disease is diffuse in the arteries. So we may see one 80% blockage and one 90% blockage, and I'll put in 2 stents, but there'll be 30, 40, 50% blockages everywhere. Those blockages can completely go away if you control your risk factors. If we get your cholesterol down, and there the goal would be an LDL or bad cholesterol below 70, and we get your diabetes to a hemoglobin A1C of less than 7, there is good data that those blockages that were 50%, 5 years later can be 10%. So
well, there's hope there.
We can reverse things if people are willing to undertake lifestyle changes and to treat their other diseases.
Yeah. Is this everything you wanted it to be when you first decided you were going to go to cardiology? Is this? Are you living the dream, like that you're treating people, you're seeing advances in medicine that will help to decrease these numbers from the time that you started till now?
Yeah, I would say that in cardiology, it's been a period of incredible advancement, both technically and sort of in terms of what we can do. We can save people now that we could never have saved 20 years ago. I would say the biggest concern, and it's a concern everywhere, but particularly in Guam, is access to care. It's getting everybody in who needs the treatment, and for many reasons, many of them being financial, can't really do it. So, better insurance and more access to care would be a wonderful thing.
Yeah, well, that absolutely. Well, you said it. Better insurance, and well, there's a can of worms there. Is GRMC at the top of its game? You think the cardiology department is relatively new to the rest of the facility?
Yeah, I think it's a great department. I think, anywhere, there's always room to do new things and improve, but we've gotten quite a few new imaging devices over the last years. Even since I've gotten here, which is only a year and a half ago, we are now doing procedures that were not possible when I first got here, because principally because GRMC has been willing to invest in equipment and invest in trying to make itself a real, state-of-the-art cardiology facility.
So you're not only seeing patients from Guam, are you seeing patients that are coming in from all over this area?
Oh yeah, we get emergency transfers from Saipan all the time. We get patients from Chuk. We just did a patient from Yap. So yes, everybody in the area who can come to us, we're welcome, we're happy to accept.
Ed has got a question to ask you. Good morning, Ed.
Hi, good morning. Good morning, Doc.
Good morning.
I got a question in reference to erratic heartbeats.
Yes.
Okay.
I've been diagnosed with erratic heartbeat twice already, so I'm getting ready to go to
Turn off your microphone.
Test at Sagamaniago.
Ed, turn off your radio because we're having too many people talking at the same time. Would you mind turning off your radio so we could just hear you?
Yeah, okay.
I appreciate it.
Like I was saying, erratic heartbeat, I've been diagnosed twice. I'm a retired Army veteran, and never knew I had it until I had to go do heart work. And then they found out that I've got erratic heartbeat. I just want to know what's the cause of it, and how could we, or myself, try to fix that?
Okay, so, unfortunately, what you're telling me is not specific enough. There are a lot of causes of erratic heartbeats, some of which are completely benign. Just having a few extra beats here and there, you don't necessarily need to do anything at all. If it is a specific arrhythmia, something like atrial fibrillation or supraventricular tachycardia, there are medications that can be used to treat those conditions. There are procedures that can be used called ablation to make those heartbeats go completely away. Basically, you need to see a cardiologist who will diagnose exactly what the rhythm is behind those erratic heartbeats. And then in most cases, yes, they can be treated and they can be gotten rid of.
Okay, yeah, because I'm getting ready to go do a stress test, but I cannot get on the treadmill due to amputation. And I guess we just have to wait and see what happens and the outcome.
Right, but you can get a stress test that's done pharmacologically. without having you go on a treadmill, and that's available on Guam. So, the people at GRC do pharmacological stress tests, and that would be part of your evaluation, as well as an echocardiogram and a long-term monitor, which you would wear for a couple of weeks to see how many of these erratic heartbeats you're having and what they are.
Yeah.
Yeah, I'm wearing the, what do you call it, equipment you were talking about for like 2 weeks where I guess they're trying to see the heartbeat rate that I was getting.
Mm-hmm.
Yeah, that's right. That sounds like they're doing the right thing, and they should be able to get some answers for you.
Okay, Doc.
All right,
that's
good luck
all
to
I
you.
wanted to find out about
Okay.
erratic heartbeat, because it kind of scares me at my
Sure.
age of 64 already. So,
Yeah.
My friend, if you're not passing out from it, it's probably not that dangerous. It's people who pass out
but
from
I
their
do
erratic
get
heartbeats that are in
little
danger.
dizziness once in a while.
Okay.
All right. Ed, good luck to you. Thank you for the call.
Thank you.
All right, take good care. That's a good point. If you're passing out, I mean, people regularly passing out?
Well, it depends what your arrhythmia is. Some arrhythmias, you'll just feel occasional extra beats in your heart, and that can happen because you had too much coffee or because you're
I've had
stressed.
that before. Yeah.
It can also go along with menstrual cycles because your hormone levels change. Some people have sustained rapid heartbeats, and if the heartbeat is higher than a rate of about 200, you can faint. So if you faint with your arrhythmia, that's a dangerous arrhythmia and needs immediate attention. If you have occasional, jumpy heart, it needs to be evaluated, but in most cases, it's not dangerous.
Okay. Wow, I've learned so much, and you should as well. February is Heart Month. And Dr. Wiedermann, he's been here for how long now?
A year and a half.
A year and a half, and he's digging it. You got like the constant tan every time I've seen you.
I'm a beach boy. I really
love
like
it.
going to the water. Yeah.
Well, that's a good place for you. Thanks so much for taking the time to be with us today.
My pleasure.
It is always our pleasure to have you. This is your third time, so you're a vet right now.
Thank you.
Your healthcare partner, brought to you by our friends at Guam Regional Medical City.